testosterone maxing. A lot of guys now are in the gym, beefing up.
Destroying their sperm in the process.
And if you take it long term, it can be irreversible. I went down a fertility journey at 43 and I was told, you've got a low AMH. I was like, okay, I can't improve the number of eggs I've got, but I can improve the quality and I can improve my host body. Then maybe they'll take our money and then we can try IVF. And in that time, I got pregnant naturally. And then I was like, right, I am not in isolation. I would want someone to get a full fertility MOT, transvaginal scans. You need a full thyroid panel, vaginal microbiome testing.
Let's dissect what AMH is. So this is a blood test that you can do, which gives you a number, is supposed to be an indication of your quote-unquote egg reserve. What's your thoughts on that test? Should people do it? What age should we be doing it? And where and how can you get it done?
Well,
Liberty Mills, it is so good to have you here.
thank you.
I'm so glad we connected on Instagram because I'm obsessed with the topic of fertility, optimizing fertility, and just all of the discussions around it, the nuances, the opinion pieces. I think it's because of what I've been through, becoming a mum at 39 and 40, having been told by certain experts that I had a really small percentage chance of naturally conceiving and all of this, and we were going to do IVF, but then we did conceive naturally, having endometriosis, fibroids, things like that, and things that I thought were going to potentially cause problems for me. And always having a low AMH on the normal distribution curve. Some people listening might think, well, what is she talking about? But we're going to get into all of that.
We'll get into all the nitty gritty.
Egg quality, when should you be thinking about testing, all of that. But first of all, what is your connection to fertility? And I know you're a fertility expert and we've been speaking a little bit behind the scenes, but just give me a real sort of quick summary as to how you've ended up here as a real authority in the space. And this is a topic that I think my audience, who is predominantly sort of 35 to 55, it's so important.
And it's important for their children as well. So what they know, they can impart to their children.
Definitely, yeah, the Gen Zs and younger, because I think, and there's just so many angles to come in from. But I think that, I was always under the impression that it was important to get an education, do this, do that, and delay. And actually no one, and there was always this connotation of, as a millennial, there was always this connotation of don't get pregnant too early. And actually what you're effectively saying to someone is, don't get pregnant when it's your peak time to get pregnant. Wait until it's harder. And we're on a totally different time zone to, sounds like, when you travel, but what I mean? We're on a totally different timeline to men. So that whole dynamic of dating and wanting things to go a certain way at a certain time, and they're not on the same page.
Yeah. But actually, there's a lot of clinical data out there on paternal health, of how that is affecting the child's health. So men over 40 who don't have as great sperm, how that's actually affecting the offspring.
Wow.
So they need to start listening up too.
Wow. Well, there you go.
So it's not just all landing at our feet.
Right. So you're dropping some gems already. So let's get into it then, Liberty. Tell me a bit about you and how you came into this whole world, this fascinating topic of fertility.
Okay, so I wasn't going to go into fertility. My background is, everyone in my family, bar me and my mum, are doctors or nurses. And me, I was like, no, I'm not going down that road. Off I went. I was a model. Or into,
of course you were.
back in the day. But I was interested in, because I was a model, health and well-being, other things like Ayurvedic medicine, traditional Chinese medicine. I spent a lot of time in Asia. And I was fasting back in the day at 19. I was doing colonics and things like that. So it was always before it was even a thing. I remember my boyfriend actually at university telling me not to wear deodorant because it was bad, and don't use tampons because they were bad. And that was back then. I'm 52 now. I'm talking about when I was 18, 19.
Clued up from early.
Yeah. So it was always on the horizon. And then mid-30s, I reversed my lupus with a functional medicine doctor. I didn't cure it, before people come after me. But I reversed all my symptoms, and that's enough for me.
Whoa. How, like, what were the symptoms and how did you reverse it?
So to put it into context, I'm about 9.5 stone now. I was 5.25 at my worst. I had a Zimmer frame. I had disability apparatus all around my house. My sofa was raised on stilts because if I got on it, I couldn't get off it.
Oh my goodness.
I wouldn't be in this studio because my face, I had to stop modeling because my face would just blister. I had lesions everywhere, like all here, and all my hair fell out there. Nasal ulcers, vaginal ulcers, ear ulcers, everything.
Wow.
Insomnia. I was on about 18 tablets a day. And after seeing a functional medicine doctor, when the NHS said there was no cure and they couldn't do anything for me, he turned it around and I got well. And I always used to have the last appointment of the day and I'd be like, yeah, but why? And where's the research of this? And what is going on in my body? And he was like, oh, you need to study this. Like, this is your passion. And years later, I did, and I thought I'd go into autoimmune. But at that time, in the middle of my course, I went down a fertility journey at 43. And I was told, you've got a low AMH. Their words, not mine. You have one barren ovary. You're going to have...
Barren, they said the word, barren.
Yeah. Yeah. And I paid them to tell me that.
Wow.
Yeah. Thanks.
That's a good clanger.
Yep. And I left and was like, okay, I can't improve the number of eggs I've got, but I can improve the quality and I can improve my host body. And then we'll go back 3-4 months later, and then maybe they'll take our money and then we can try IVF. And in that time, I got pregnant naturally. And then I was like, right, I am not in isolation. This is what I'm going to do. So then we went into COVID. I had my baby, wanted to have time out with her. I trained as a postnatal doula as well because I didn't think there's an infrastructure for the 4th trimester for women to be looked after.
Mm.
So it's all out of personal neglect, I would say, go too far as to say neglect, that made me want to try and help other people.
An incredible story. And now we've arrived at now where you have...
Yeah, like 6 years later.
Yeah, so we arrive at the present day. This book, the 360, so it's 360 Fertility.
Yep.
This has been out now for a year.
Yeah.
And it says here, a 12-week plan for optimizing your chance of conception. I love the word optimization.
Optimizing. Yeah.
I love it because the reason I love it so much is because it speaks to something that we have, which is control over what we do. And like, there are so many things that are out of your control in life, such as, to a certain extent, fertility. You know, you can't always control, you know, everything that happens, but there will be things that you can do for yourself that will optimize your health. And even if you don't end up having children, you will still... Actually, someone said that to me once when I'd had a miscarriage, and I went and did a whole ton of things. And like you, I've got like a science brain where I love, you know, experimentation and to read data and to try things. And someone said to me, like, even if you don't have children, you would have done so right by your body.
Exactly.
You will thrive later in life. So everything you're doing now is not in vain.
Yeah, and even whatever your path to parenthood is, if it's adoption, surrogacy, whatever, you're going to be a healthier parent.
Exactly. I was adopted. There's no way that I would always say like blood is thicker than water and all of that. But I do think that, you know, especially for women in their 30s who are being told you've got all the time in the world, you don't. And actually, there's certain things that it's just good to know before it's too late.
Yeah.
And like the other day, I heard someone talking about how endometriosis harms the quality of your eggs. I didn't know that.
But also, it's your body. It's like, where also is the endometriosis? Do you know what I mean? Where is it? It's your host body.
Yeah.
Even if you had a donor egg, it's still going to impact that maybe, right? So you need to understand your body and what can you do to help it. And also, I believe that we're a team. You know, I've just come from ESHRE. I'm in the middle of ESHRE. It's the European Society of Reproduction and Embryology Conference. And, you know, even the scientists are arguing, you know? So it's like we need to be a whole part of the team. The more we're informed, the more we can tell our medical team and the more we can work together.
Exactly. Meaning that have agency over, you know, your body, you know, get on regular testing, make sure you do the research, and then it's just, I think it saves time. I'm so big on time when it comes to women because our timeline, I know we touched on, obviously it is important for men too, when
Yeah,
the
as
fertility
well.
piece is maybe as high as 50%, in terms of the issues that may occur. But like for women, our timeline is so different. Our time in the workplace, our earning potential, we're compromised.
Yeah.
And so optimization is so important. But the starting point for me that I'd love to ask you about is testing, because moving on from having
Test, don't
agency.
guess, I always say.
Exactly.
Test, don't guess. I was at, sorry to interrupt, but I was at
No,
my
go on.
friend's house last night and I was like, what is all that? And there was this huge carrier bag full of supplements. And I was like, why are you taking that? Why are you taking that? Why are you taking that? I don't know. I just saw such a person on Instagram there taking it. And I was like, all of the bulking agents within all of these things, and if you're taking them at the wrong time or with each other, you could be doing yourself more harm than good.
You can't get your vitamins out around you because you'll just know too much.
Yeah, and I was like, first of all, test. You don't even know if you need half of this stuff.
Yeah. I think when you measure something, then you're able
Yeah.
to make a difference. So what tests should every woman consider getting to check her fertility status, regardless of age? Obviously, I guess the earlier you do it, the better. But I'd love to know from you, like, what test?
I'd always say, I'm quite sick of people just thinking fertility is your reproductive system, because it's not. Everything else affects it as well. So basic things, of course, this is a controversial one, the AMH. I've just been at ESHRA and there was 2 conflicting studies. There's a lot of support now saying that even NICE guidelines are saying that it is not a test to tell you how fertile you are.
So for those people, because I know exactly what we're talking about with so much, but I want to
but it's
make it
something
really...
that people get scared about. They're like, oh my God, I've got a really low AMH. Do I need to go and freeze my eggs? Am I going into the menopause?
So
and
let's
it freaks
talk about
people out.
Yeah, let's dissect what AMH is. So it stands for anti-malarial
Hormone, yeah.
So this is a blood test that you can do, which gives you a number, and that number is supposed to be an indication of your quote unquote egg reserve, right? So it's a non-invasive way. Well, it's invasive, you get a needle in the arm, but of seeing, an indication of how many eggs do you have left. So what's your thoughts on that test? Should people do it? What age should we be doing it? And where and how can you get it done?
Well, okay.
I'll start from the beginning. Should people do it?
It's why would you do it, I think, is the question.
So the why would be, okay, so let's use a proper real world example profile of a person. So I've got a friend who is 35.
Okay.
She's just broken up with her boyfriend.
Okay, yeah, 35. So they're saying the clinicians and the scientists yesterday and today, it sort of kicked off as well.
She's full of this conference today, Liberty.
Yeah, I am so full of it. Below 35, it is not a marker that will solely say how how fertile you are or when you're going into menopause. What it does help is in a clinical setting, if you're going for IVF, what drugs they're going to put, what protocol they're going to need
and
for
how many
you
eggs you might possibly be able to
retrieve, like how much are they going to stimulate you. So within that setting, it really does help. If you're just Sarah and you're 32 and you're just trying out your boyfriend for the next 6 months, it's not going to help you.
Right. So for those people who don't know what we're talking about, maybe still, so an AMH result. So let's just like really simplify it. So say like 10 means you've got loads of eggs left, and 1 is you've got hardly any left. So if Sarah at 32 did decide, you know what, we don't want to have kids right now, but I just want to see where I stand so we don't run out of time, I'm going to do a test. And I've been told to go and get my AMH level checked, right? If she does do it though, and it comes back as like a 2, isn't that then a really good warning sign for her to like that she might need to get a move on quicker?
Well, this is what the whole discussion was today. And they're saying NICE guidelines is no, it's not.
So what would be, okay,
but I think that's really confusing for people.
So what would you advise then if someone's coming to you?
I would want someone to get a full fertility MOT.
Go on, what does that
And I
consist of?
think you need like a transvaginal scan so they can see how is everything, fine in there. Have you got any scarring? All of those things. You need a full thyroid panel, not just your T3, T4, TSH. You need your thyroid antibodies as well.
Why?
Because that could be, if they're high, for example, like mine were high, that could be sending a false signal that everything is fine. But really your body's going like this, working really, really hard to say it's fine when it's not fine behind the closed doors.
Okay, so a certain blood... So to simplify it then, you can get blood tests. So for example, one of the ones that I get, like it's like called Good Body or something. It's like a brand where every 6 months now, I'm going to be 45 soon, so every 6 months I have like a subscription where if I want, I can turn up and get like
amazing
advanced well woman profile or
yeah.
something, and that will show me, my full blood count, so kidney function, all of that will show me if I'm anemic.
White blood cells, if you've had like an infection within the last 6 months before, it can really affect your fertility. Vaginal microbiome testing, that's really, really big now because...
So going back to your list then, so with thyroid testing, that would be a blood test.
Yes.
And thyroid function can affect fertility. So
immensely. So and it also can affect early miscarriages as well. So you could get pregnant but have recurrent miscarriages.
Right. Okay. So one of my friends was just telling me a story about how she literally was focused on IVF. They did it years ago, and then she keeps getting pregnant. She's been pregnant, I think, 3 times now, and once was with twins. And she is like, it's unexplained. And she didn't mention thyroid testing.
Yeah.
So we've got that. What else is on the list?
Vaginal microbiome testing.
And what is vaginal microbiome testing?
So even my GP didn't know about this when I went to discuss it with her. I was like, I've had my vaginal microbiome test and I've got a bit of ureaplasma and I have low lactobacillus. And she was like, what?
I think actually back in the days, I think I know what you're talking about, because when I went down this road of throwing everything at the wall, seeing what sticks, and I ended up in a fertility place on Harley Street where I think I did all of this because they were like, right, we want you to test X,
everything.
Y, Z. Yeah. And so tell me what you do. I think, it's
just a swab.
Yeah.
You just put it up there.
And then there's a reading that you get.
And then they
like
give you a reading.
Test.
It's a bit like, just like a smear test. And there's certain clinics, our IVF clinics, like I know Dr. Victory in Canada, he does this as standard before you even start your IVF protocol.
So I'm going to put this in the show notes, actually. So because I think it's really important for someone to refer back and be like, right, if I want to go, all guns blazing, and I want to invest in all of this, and I'll talk to you a bit later about how people go about certain things on the NHS as well. It's really good for them to know. So far we've done AMH test over 35.
Yeah, and I can send you all the clinical data as well.
Yeah.
And a lot of it is out there, but people don't know where to find it. And I can send you everything, log it, and then they can all get it.
Yeah. Thyroid test.
Yeah, thyroid
which
test.
Which is a blood test. Vaginal microbiome
test. Vitamin D test.
Vitamin D test, so important. I remember going to a fertility clinic back in the days just to talk to them. I think it might have been... Is it Zeta West?
Yeah.
Yeah, so I remember them saying to me...
She's also got a great book out as well.
Food book, yeah. And I remember them saying that they'd had patients in before who had been trying to conceive and they literally upped their vitamin D and conceived. It was literally that simple. And I remember at the time getting a vitamin D test and it was like 35 or something. They were like, we would want yours. I mean, ever since then, mine's now been like 80 to 100 because it's stuck in my head.
Yeah. But that's the difference of being deficient or okay or optimum. And we want it to be optimum for fertility. Also, you've got to think it's not just for me. When my clients come to me, I say, you're not my client. Your future baby's my client. And it is my responsibility that they are the healthiest child I can make them.
Whoa. That is deep. That's very deep.
It's important because if you're going in with low vitamin D, it can affect their health and well-being. So it's not just simple about getting pregnant.
And vitamin D is such an easy fix. And if you are a person of colour, you're less likely to absorb it in this country. the country that we're in right now is the UK. I know we've got.
I know it's sunny at the moment.
I
But
know, and also like half of our analytics show that like actually like half of the viewers are in America. So some people might
right.
be in sunny LA. I don't know.
Yeah.
But
then you've got the shadow rule and how much of your body is exposed. And if you're obese,
what's the shadow rule?
So you if you're in the shadows, you're only absorbing a certain amount, right? You've got to be full out there in the blazing sun. And then not many of us are unless you've got factor 50 all over you. And then you're not going to be absorbing as much vitamin D, are you?
Exactly. So you can get a vitamin D test quite inexpensively, or you can get a full profile done where you click, tick all the things we're talking about. And then if it is, like for me now, I'm always aiming for it to be kind of like 80 to 100. I also at one point was taking real high potency, I don't know, it might even have been like 50,000 international units a day.
But you don't want to overdose, and that's why you have to have the
But
test.
can you overdose
first.
on vitamin D?
Yeah, you can.
But what would go wrong if you did?
You can. All sorts of stuff. But that's why you have to test first.
Fine. So let's say.
So test first. You can, in the UK, you can get a test for as cheap as £10.
Right. So vitamin D test. So that's another one. What else are we doing?
Because to me, that is really important.
And an easy fix. D3, high potency.
Yeah, and you want to, if you're taking it, you want to take it with K2 as well, because it then makes it more bioavailable within your body. And also try to take it with a fat. So I always take mine with my omega-3s because it's fat soluble.
Good information. I didn't know that.
There you go.
And then, so what else is on the list then?
I've forgotten what we're talking about now.
So now we
test, don't guess.
Yeah, we need more.
I know it's probably women listen to this, but if you've got a male partner, they need to get a test, because there was a whole day on that today that we are using women as a diagnostic thing for fertility when, like you said before, 50% of infertility is a male factor, and within that 20 to 30% is a sole male factor. So I've had clients where the women's had, invasive surgery, all sorts of stuff, and then 3 rounds of IVF down, they're like, oh, actually it is the man.
So yeah, you would say, and I know that very sort of, good IVF clinics will always get both male and female, or, everybody's in different partnerships. But
they'll do quite often just the frontline testing, but not, because there's so much controversy around DNA fragmentation, all of these things. Like a lot of, if you go to your GP, they might test you for STIs, your sperm motility, the morphology, your count, your volume. They're not necessarily going to test your folate, right? Folate we always think as women, but folate really affects men, their sperm. So if the guy's got low folate, that's another low cost treatment that you can just do at home that could really help impact. If you're in a heterosexual couple, could really impact things.
Okay, so what tests could, and I also want to at some point talk about how in a sort of, in a couple dynamic, how we go about, because, I've had conversations with people before where they are getting resentful around the fact that they're doing all the tests, their partner isn't, but then some men think differently to women, and they're not maybe going so hard at the optimization, and it's like trying to strike that balance of not like blaming each other.
Yeah, I think it's about including as well, because we women, you might have started menstruating at, I don't know, 10. You're sort of a bit more clued up about the whole reproductive thing.
Yeah.
We talk about it with our girlfriends, or you might have been to the GP or your gynecologist. Generally, the only time a guy talks about it is if it's not resulted in the baby that you wanted. So it's a different thing for them.
In terms of continuing on with that list of the MOT check, from a male perspective, what can a man do?
Physical examination as well. Check it. I always go like this. I'm like, how big are they?
You're scaring any man who's listening to
they're
this
not
somehow.
that big. Sorry. Checking for varicoceles as well. So it's like a varicose vein. So it's a blockage. So
who's going to do that check though? Because
the GP.
Fine.
The GP. And you can also have an ultrasound as well.
And by the way, where can someone do? Is this all stuff that has to be done privately? Because
No, you can go to your GP,
and ask for
your
all of those
NHS
things.
GP. Say, I've been trying to conceive for a year and a half, and we're not getting anywhere. Can you check me out?
But are they going to do things like the thyroid test, the microbiome,
For a
vaginal?
woman, they're not, but the man, they will. You can ask for a physical examination, and you can ask for an ultrasound.
Okay, fine. So we'll go through the whole list, and then we'll go through which is private, which has got to be
Yeah.
private, and which at the
It
moment.
depends who your GP is as well. Like some
Yeah.
GPs are quite, if that's been their little geek out speciality, they might push for it, but if not, they won't.
Okay. So with a man, potential physical examination if they're up for that.
But men, please, 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 like if you've got a brother, partner, whatever, or if you're young and your dad's on a next relationship, please encourage them to do it because, your sperm health is also a great indication of your heart health. So it's not just about having a child, it's about your overall health.
Yeah.
So I
Do you know
really
what?
want them to start looking at their sperm and talking about it because it can be an indicator to other things that are going on in your body.
Yeah, because even me saying that if they're up for it, it's like assuming that they won't want to, and that we as women are doing lots of kind of diagnostic stuff. It's a
Yeah.
really difficult topic because I feel like I don't want to make men feel like they're
I
being
want to
attacked.
I want to include them. I'm
Yeah.
like, come on. I'm like, it really annoyed me today. So I was in the AMH lecture and it was 80% full. And then I went to an andrology DNA fragmentation conversation. It was 25% full. But if we've got 50% is a male contributing factor,
Why
the
is there not?
science needs to be in there too.
Yeah.
So also testosterone maxing. A lot of guys now are in the gym. They're beefing up
Destroying their sperm in the process.
with their testosterone.
So talk to me about that relationship.
So a lot of, we always thought testosterone make, manly and it's, going to make your sperm really great. It can really make it not great. And if you take it long term over a number of
You're
years.
talking about people who take it for the gym.
Yeah, it can be irreversible. I was talking
Wow.
to a male fertility clinician on this yesterday, and he did a video for me just like imploring, please understand the risks.
What else can be very damaging to the male sperm count or even its quality?
Vaping, people just think it's nothing. It's really,
Is
really
there data
bad.
that backs it
Yeah,
up?
I can
Wow.
send it to you. I've
Wow.
sent it to a lot of my clients in Dubai who are like, oh, it's fine. I'm like, nah, read this. Obviously, too much alcohol, recreational drugs, sauna. So a lot of men now are ice packing in the sauna. I'm just like,
They're
just don't,
putting ice around their
yeah,
balls.
yeah. I'm like, just don't go in.
Ice around their balls in the
Yeah,
sauna.
yeah.
In the name of fertility or in the name of cool balls?
No, in the name of like, if they want to keep their sperm intact, but they still want to go in there. Yeah, it's a thing.
So
But
then
even Huberman goes in, Professor Huberman, he even talks that that's what he does now.
but saunas are good for us though, right?
Yeah, but too much heat is not good for a man's sperm. That's why they hang. That's why they're outside of their body to
Right.
cool and keep them cool.
And also like phones in the pocket by the
Yeah,
balls.
phones in your pockets, laptops on your now. Also your quality of sleep, diet. We're all going, what test can we have or what is the science that's going to be helping us? But we also got to understand our responsibility. So quality of sleep, the rise in obesity, these things too.
Okay, so going through that list then of the things that can help us to optimize and doing the MOT check rather starting point. So we are checking out sperm count and quality.
Yeah, morphology.
And that would be on the report,
DNA.
right?
Yeah, that ill is. DNA fragmentation won't be at
Is
all
it?
places.
So talk to me about DNA fragmentation then, because is it like
There's
the
another
head? Is
row.
that the head of the sperm?
It's no. So that's like, yeah, it's about how the DNA within it, how it's broken up. So you can have single strain, double strain, but there's also rows on the scientific side whether that is an issue
So
or
what's the
not.
row happening?
So, so some scientists say, oh, it's all fine as long as we find the right ones, it'll be fine. And then other ones are like, it's not going to be fine. So it depends what clinic you go to, whether they think that it is an issue or it isn't an issue. So it's hard. But then we've got other clinics that are bringing in AI. Yeah, AI to go in and choose the most beautiful, strong, gorgeous sperm to select it.
But isn't that what they do with like ICSI and IVF, where they would like select a
Yeah,
good
but that's
sperm?
with the eye.
Is that done with the eye?
Yeah, it's quite often done with that. But this is like they're using the eye and AI together.
But I guess that's okay though, right?
Yeah,
Because it's
I
just a
think
selection process,
it's
and
really, it's all the power that we can have, I think is great. And that was the future science that was listening to today that was really interesting. You know, we have like continuous glucose monitors.
Mm.
They're developing continuous hormone monitors.
I know of somebody that's doing that
Yeah.
already. I read about this
I think
recently.
this is going to be brilliant.
There is a couple of clinics in the UK that do this now,
Yeah.
where you can actually wear this hormone monitor
Yeah.
and see where your estrogen, progesterone, everything is at during any time of the month.
Yeah.
This is already technology that's
Yeah. But they're going to be doing it as like a thing that you can buy on the internet.
wow. So to make it more accessible, the chat we're having as well. So when I was talking about ICSI, I'm talking about a form of IVF where, because with IVF, the egg and the sperm are left in a dish.
Yeah, they're left in a dish, and then it's like survival of the fittest. Who's the champion to get there? And
Which sperm you mean?
yeah,
And then it will just do its thing as
it
if
do
they
its
were in the
thing.
uterus.
Yes.
But with ICSI IVF, which I can't remember what it stands
it in.
for, but yeah, they would take one sperm,
Yeah.
perfect sperm or whatever,
Yeah.
and then they'll put it in the egg,
Yeah.
almost force it in there.
Yeah.
There's downsides to that, is there
Yeah.
not?
And some clinics do that as standard as well. So, and then you've got your testing, all of those things. But I think people need to strip it back as well and start looking at what we're putting into ourselves. So, before, in my book, I do all that, the testing, but how many chemicals are you putting on your body a day?
Mm.
What are you gifting your child? Average woman puts on, 164 chemicals on her body every day. That's the average woman.
Mm.
Are you putting on hair relaxers, the nails, the perfume, all of those endocrine, SPF? One of the worst endocrine disruptors going. Glyphosate. Professor Shauna Swan did an amazing documentary on microplastics and glyphosate and infertility. I think it's on Netflix at the moment. But her work is phenomenal. And it was just on those things of how that is influencing our fertility.
Yeah.
We can't get rid of it. Like, you're not just going to, even if you went and lived in a field, they might be spraying those crops. Do you know what I mean?
Yeah.
But it's, where can we remove and replace? Our skin is our biggest organ. And we have to remember that. So it's like, for a woman, do you go for a toxic mascara and eyebrow thing, but your foundation isn't? Do you know what I mean?
Yeah, I think
you can't get caught up in it. You're going to stress yourself out.
No, there's so many things. I think it's about trying to like reduce chemical exposure where you can. I think everything's about exposure.
Yeah.
I.e., one bad face cream once is not the same as chipping away every day exposed to parabens and endocrine disruptors. So
it's the difference between binge drinking and having the odd drink.
Exactly.
That's the way I sort of see it.
100%. So is there anything else on the list of the MOT that people could be doing? So we also haven't spoken about like the follicle count that you could get done.
Yeah. So that's another thing. So yeah, you can check how many viable follicles you have.
And how do you do that?
You would go to a clinic. That's another thing that they're going to be bringing out. So you can do it at home.
You can do a
our whole,
follicle count at
yeah, they're
home.
going to be, it's like a little backpack thing, and you just do check it yourself. You scan yourself, because not everyone can. You've got jobs. You can't just be popping down there every couple of weeks to check, oh, is it a good time for IUI, or is it a good time for us to try naturally?
Yeah, this is the thing as well. I think when you're trying to conceive, it's so potentially draining on a lot of things, your work, your potential to earn money. Um, I remember I was doing like maybe like it might at the time it might have been like 6 radio shows a week, and then when I got pregnant because it was COVID, I said to them, I can't do these weekday shows because I'm scared of coming in the studio and getting COVID.
Mm-hmm.
So I ended up dropping down to might have been just like 1 show a week remotely, because I was just like, I didn't want to go in. I just thought it's not worth it. I'm 39, I've already had 1 miscarriage. I don't want to get COVID. And it's like, as women, we do get very impacted. Our productivity, our ability to earn money, it gets heavily impacted by sometimes the mission of trying to conceive and staying pregnant,
And the
um,
relationship.
and the relationship. Yeah.
People don't talk about that. I have men crying to me, can I have an extra session? And they'll be sat in their car crying to me going, I just, I feel like we have no relationship. I just feel like she only wants to have sex with me when we're trying for a baby. I've lost that intimacy. And that's really important.
Mm. We should talk about that then as well. Let's make sure we return to that.
Okay.
So we've got the blood test, the vitamin D check, the antral follicle count, which is something that is like a
Yeah.
transvaginal ultrasound that essentially counts how many follicles you have.
Yeah.
That gives you an indication of how
How,
many eggs you have.
yeah, how many
Well,
eggs you have, and
potential eggs.
what's responding as well. So they might, I've had clients, for example, say, oh, I've only got 3 good ones, or one's too big and then one's a great size. This month isn't great. But then they go in next month and like, oh, this is a great time to go.
Okay.
So in that way it can take a bit of the stress out,
Yeah.
and then you're reassured.
So is there anything else on the MOT list that people could do if they really want to optimize their fertility and understand, should I say, where they're up to? Like going back to that 35-year-old or,
Mm.
33, or someone in their 30s who is thinking, I haven't had kids yet. I would like to know where I'm up to, but I'm not actually ready yet. I just want to know, have I got to be ready
Yeah,
soon?
I'd fully go, because some things might take a while to get back up. Do you know what I mean? Or do you have Hashimoto's? I had one lady, I was like,
What's
I
that?
think it's a thyroid autoimmune disorder, and a
Ah,
lot of women have it, or you might have Graves' disease. And I had a couple of lawyers that were diagnosed with that. And then their endocrinologist said, you can't try to get pregnant for at least another 3 to 6 months until we level this out, because you're
okay.
at much higher risk of a miscarriage. So if you're 35 and you've not really thought about it, you think, oh, I'll just test when I'm in my late 30s. What happens if then you do have something and you have to wait another 6 months or 9 months until you level out to an optimum level on your medication? It might take months, many months. And that's a number of potential cycles that you're missing for it to level out.
So let's simplify it then. In terms of like the age and the test that they should do, what do you recommend that women are doing in their adult life, and when?
I might be being overcautious, but that's probably because I see women from 27 to 50, and they've all, apart from say AMH, they've all got similar issues. It's a lot of thyroid issues, low vitamin D, vaginal microbiome dysbiosis. It's very age indiscriminate. Is that a word? Yeah. So I think as early as possible, because you don't want to just assume because you're 27 that everything's okay.
Then it leads us to the question, where are people able to get these tests done? How do you go about doing that? Because if you are doing it in your 20s,
You don't have any money.
yeah, and then could you even get a referral for these tests? Because what can you do on the NHS?
How do they know how long you've been trying to have sex for to have a baby? They don't know. If you go in and you're 27, you could say, I've been trying for 2 years. They don't even know that you've got a boyfriend
Is
or
that the
not.
hack then? Would you use
You
that
could
hack?
be a lesbian. They don't know. It's none of their business. I would use that hack.
So I've been
100%.
trying and it's not working. Can
Yeah.
you get me tested?
Yeah.
Okay. And then what tests would the NHS give versus what you'd have to get privately?
And NHS would stand alone. They don't even do vitamin D anymore. They do your normal blood count, so your white blood cells, your red blood cells, basic thyroid planol, folate, um, your AMH, your T3, T4, your FHSH. That's it. And but then from there, if something looked out of sync, they would do further investigations.
Okay. Let's talk about egg quality because it's not just about age, is it? I mean, obviously, there is a huge relationship between egg quality and age, but is there things you can do on a kind of micro level, like every 90 days when a new egg is made, that means that you are improving the quality of the egg, or is it literally just declining with age and there's nothing you can do about it?
That's also where the science is arguing.
What do you
I
believe?
truly believe you can improve your egg quality and your host body. So also it's about where is it implanting? You know, if you've got a stressed out body that's in fight or flight, it's not the best time for it to implant as well. Like you've got nature is trying to look after you, you know, that's its job. The body is trying to make me wake up tomorrow and face the world. And if I'm struggling with that, it's not the best time for my body to conceive.
Yeah.
We've got to think of that as well.
Okay.
And I know we you know, we're constantly on our phones. People take their phones to bed. They wake up, they go on their phones. And I always say to them, if you know, what's your favorite car? Would you put that straight into sixth gear? And they go, no. And I said, and then would you drive it down the road in sixth gear? And they say, no, no, no. I'd, you know, go through the gears. Would you take it for an MOT? Yeah, yeah, yeah. We take better care of our cars than we do our
Yeah,
bodies.
that's true. That's so true. And as I'm asking you these questions as well, I'm keeping in mind the person who is trying to conceive and potentially is struggling and has maybe tried IVF or is in the process of doing IVF, is maybe trying to conceive spontaneously, i.e., without assisted reproductive help. So that people can, you know, just as a reminder, because I know we're going like into detail about certain things that people might not understand, but I want people to watch or listen to this and be like, right, I can try that. I've not tried that. This could be an issue. This is something that I could look at in terms of testing, but this is also something that could like improve my host body.
So I think
or egg
if
quality.
you go for IVF and it doesn't work, ask them why they think it didn't work. What would they do the next round differently? What further testing would they do rather than just go into another round? Ask them, what other tests do you think I personally need?
Okay, let's actually focus on people who are trying to conceive, have been doing so for some time, and may not know why they're not, and potentially those people who are doing some form of IVF. Have you heard of the whole natural killer cells thing?
Yeah, yeah.
And what's your thoughts on that? Because that's basically, to put into context, I had a blood test done where they wanted to, the fertility clinic, ARGC was who I was working with. They're like one of the top fertility clinics. And they have like lots of successful data in terms of, you know, high rates of pregnancy and births. And they basically, I'd had a miscarriage and they said to me, let's check your natural killer cells. They did a blood test. I think got sent to America. It's like quite an expensive test. I think it's maybe a couple of hundred or more. I can't remember. But you get this test done and then the result comes back. And if it shows an indication that you have like natural killer cells, you then go
You
for
can have
something.
your drip.
Yeah, an intralipid drip,
Yeah.
which is like almost like, I think it's like mayonnaise. It's not actual mayonnaise, but it's got an
They call
element
it
of
like the
that.
mayonnaise drip.
Yeah.
Yeah.
And you sit there reading your magazine on your phone for 45 minutes and you have this drip. I did get pregnant afterwards, though.
Yeah.
But what's your thoughts on that whole concept?
I've had a number of ladies, especially who are older, who have done that and then gone on and had failed IVF before, then found out that, and then gone on to have a live birth.
So there you go. So natural killer cells
Natural killer
testing.
cells. And, I know it might be a few £100, or even some clinics, it might be up to like £500, but that's cheaper than doing another round of IVF, and also the emotions of going through another IVF.
Yeah, exactly. So
If that might have been the issue that you needed to resolve.
There's lots in the fertility circles about antioxidant-rich foods. Cutting back on alcohol is obvious. CoQ10,
Yeah,
good supplement.
CoQ10.
How does that work?
Myonisotol, for not just for it's for the older lady as well. We've found that out. It's been clinical trials shown that it helps better egg retrieval, embryos, and implantation for the women over 35. NAC within an IVF setting.
So NAC is what?
I
Is that
can't
like
pronounce it.
It's like it's something that helps is this all to do with like mitochondrial health?
Yes, it is.
So cell health.
So if you think about it, it makes sense. If you're an older, keep calling us older ladies, advanced maternal age, they call it, and that's why you're not conceiving, because you're an older lady. It would make sense, wouldn't it, to repair the body, to repair the cells. So what they do in an IVF setting, some clinics are giving 1,800 milligrams in over 3 doses, so it's 600 each time of NAC, and then the women need less medication as well.
Wow.
So it creates a gentler IVF for them as well.
I didn't know that.
So it might be nice, this is why I would say, like, take this paper to your clinic and say, what do you think on this? Can we include this? What are your thoughts on that?
Yeah. And so if we've lost anyone, basically NAC, I think NAD is as well.
Yeah, it's the precursor to NAD, isn't it? You've got your NAC, your NMN.
Yeah. So all of those kind of supplements that we're referring to are to do with repairing and reversing cell damage.
Yeah. So they're saying, our eggs are bad quality because we're older and it's only the older ones left over. Why can't we help repair their cells?
Exactly.
Make them nicer.
Yeah, and that's because they're going through a life cycle, isn't it?
Yeah.
Of 90 days.
And also, if we've got to remember that it doesn't just start with an egg. So if you've got a better quality egg, it can help repair the sperm, and when you've got a better quality sperm, it can help repair the egg as well. So they work together. So if you've got advanced maternal age and advanced paternal age, and they've both got issues, it's going to be harder. So that's why I would say you've both got to have optimum goods going in, because they need to help each other.
Absolutely. So because there's the book, isn't it? It starts with the egg, starts with the sperm as well.
It starts with the sperm as well.
Okay. What about, so DHEA? I got quite down a rabbit hole on that one back in the days.
Yes.
Thinking that, so from what I understood, DHEA is a way of actually increasing your testosterone, and testosterone helps ovarian health.
Yeah. So we often think testosterone is just a male thing, right?
We need it.
We actually have more naturally than men. I, as a menopausal lady, take testosterone. I rub a cream.
I do now as well.
Yeah, and it's really good for my mental functions, my cognitive function. So it's things like, that. Also, many women who've had early miscarriage may be put on progesterone as well as soon as they get pregnant.
Same, I took that.
Yeah. So ask your GP, say that, I've maybe had a chemical pregnancy or early miscarriage. Can we explore both of these?
So basically, we've touched on just a few of the things to think about if you're trying to conceive, if you've had multiple miscarriages, from CoQ10 to progesterone to aspirin is even another one, isn't it? Blood thinners for trying to conceive, which I touched on with Professor Asma Khalil in another podcast, actually. But why don't we? So those are all things that are worth looking into. But why don't we now talk about egg freezing, embryo freezing, whether it's worth doing, and a little bit of the whole embryology and stuff, because there's tests that you can do on an embryo, isn't there? Like a PGT test to see the quality of the embryo. But anyway, for those women who are single and they're thinking, I want to go and freeze my eggs, whether it's in their 20s or their 30s, to try to preserve their fertility for the future, what's your thoughts on the concept of egg freezing and whether it's effective?
Well, we know now egg freezing is not as good as freezing an embryo.
Yeah.
But hey, if you're in you're 25, how do you know that that's the guy you want to have your baby with later on in life? So it's a bit difficult. And we know now that depending on age, and I can send you the data on this because I don't know off by heart, but depending on your age bracket depends on the amount of eggs you need to retrieve for the prediction of that you will then be able to fertilize one.
So basically, in other words, it's a numbers game. So
Yeah,
the more
it's a
eggs you
numbers
have.
game.
So say, for example, you manage to have 50 frozen eggs.
Yeah, but it's also the quality of them as well. So of course, if you're younger, you might only need to harvest less, but by the time you get to 35 or 40, you're going to have to harvest way more to get better quality ones.
Would you say there are many 40-year-olds even freezing eggs?
Like, most clinics won't do it, but some of the foreign clinics will.
Okay. So what would your advice be?
I don't know what the ethics and morality is around that, but yeah, they will.
What would your advice be to somebody who is wanting kind of like a proactive, defensible strategy for like preserving their fertility?
First of all, look at your periods.
Okay.
To start at the beginning.
Okay.
Look at your periods. Also, ask your mum if she's around or you know anyone that knew her back then. When did she go into the menopause? Because we know now that that is a good indication of when you will go into a menopause.
Okay. And when you say look at your periods, what do you mean?
Are they, apart from the first day, there's a difference between being uncomfortable to the point where it's been uncomfortable, or you can't go to school, or you can't go to work, or you're just laying on the sofa and paracetamol's not touching the sides, or you're bleeding through your tampon and your pad.
If that is the case, though, what does this indicate?
You need to go to your doctor, and you need to, if they say, it's just, the luck of the draw, or everything will be solved once you have a child, go for a second or a third opinion. And then if they don't listen to you, you complain to your practice manager, and you reach out to someone like me, and I'll send you to a lovely doctor who will send you the nice guidelines. You send that then to your practice manager, and you get referred to a gynecologist.
Because what potentially could be going on?
A number of things. You could have endometriosis. You could have an autoimmune disease. There's all sorts of things.
So if someone was having like periods that were abnormal, super painful, clots,
you shouldn't be having clots.
And if that was happening and they managed to get like a referral and they found out that they had endometriosis, for example, even though that can take a while to diagnose, which is kind of annoying.
Yeah.
But like, let's just say they found that out. Would you then say, because this was linked to the whole egg freezing thing, would you then say, go and freeze eggs because actually endometriosis, we now know, can damage your ovarian reserve?
Yeah, but then what they will most likely do is go in and have a look and see what the landscape is inside, and then they can give you a diagnosis and tell you whether you should or you shouldn't.
Okay. So the periods are a great indicator.
I think the periods are a great indicator, and we've just been told to mask it and shut up and just take some painkillers and get on with it.
Yeah, I think a lot of people just assume that if they have heavy or painful periods, it's kind of normal.
Or my mum did, or well, just because your mum did and your auntie did and your sister did, maybe you've all got something that's not very healthy.
As a general rule, though, for someone who believes that their health is normal, what would you say to like younger women? What's your kind of bog standard advice in terms of like egg freezing, whether you think they should do it or not, and what age do you think people should try to do it? Should someone, for example, should a 25-year-old who potentially has like great quality eggs, should they go and try and do as many rounds of egg freezing. This is me being a bit extreme now, but like if I could go back to my 20-something self, I absolutely would have frozen
I
eggs.
know what I would do. I can't tell anyone else
Go
what
on,
to
what
do.
would you do? I'm not
But
saying.
I know what
Give
I
me
would.
your rogue advice. I
For
want to hear it.
me, so I've got a 7-year-old. I've got a 29-year-old and a 7-year-old, right? When my daughter's 21, I am going to, and loads of people will come after me after this, but I don't care. I'm going to offer to pay for her to get her eggs frozen. I'm going to do all the tests first because I don't want her making the choice to be with some sort of man because she's like, oh, I need to choose him now and hurry up. I'm 35. I've done whatever I'm doing, whatever. I need to go and choose him because I want to have a baby, which a lot of people do.
Yeah, but you could still choose wrong anyway when you're 45.
Yeah, but you could do, but some people hurry up in their choices because their time is running out.
A lot of women do that. And so
Yeah.
would you say that to solve that, it's egg freezing?
I wouldn't, but it's nice to have the choice.
Okay. So you believe that it's good to kind of, in your early 20s, get harvesting the eggs?
I would if I could, yeah.
Okay.
And if I could offer that to somebody, I would. Because also we don't know what's going to happen. I know it's
true.
freaky, but, you know, I've had friends that have had, you know, certain cancers and things like that, or
Yeah.
you might have to go on certain medication that could affect your fertility. You know, a friend of mine recently was diagnosed with cancer and then had to quickly, while trying to get her head around that, go and freeze her eggs. If her eggs were already frozen, she wouldn't have had to delay her cancer treatment.
Wow.
You know, and that's an awful predicament to be in.
So as a general rule, as young women, we should really be looking to, I mean, I know I would, if I had my time again, that I wouldn't have been buying Prada trainers with my student loan.
Exactly.
I would have been
I
freezing
know
as
people
many
say
eggs.
it's a lot of money, but people spend a lot of money on festivals or an outfit or, you know, what a snazzy handbag.
It's not easy to do, you know.
No.
Egg collection is not like some just go and get Botox or something.
No, it's not like the guy's the sperm, they just masturbate and it's done.
Yeah, no, it's a whole thing, and
But
isn't
I would
easy.
also, I was chatting to some professors and I said, you know, we're going to start encouraging guys to like freeze their sperm too.
That makes sense.
Yeah.
It's easier.
Because it's easy for them.
They don't have to be sedated and go through like almost.
It's not a procedure.
Let's talk about black women, black and brown women, as it pertains to fertility, because I know that you were at the Black and Brown fertility show, right?
Yeah.
And I know that you're dual heritage yourself.
Yeah.
What is the relationship between fertility and black women as you see it? I know it's a bit of a broad question, but can you talk me through some of the really important themes that you think that we need to be addressing in our community?
Vitamin D.
Yeah.
So St. George's Hospital, where I had my last baby in London, absolutely amazing. And the reason I went to them was because they're doing early testing, because they have a high risk factor, obese, hypertension, and ethnic minorities. And they actually did a panorama thing on them maybe like 8-9 years ago, that they had the highest rate of intervention.
Who did?
St. George's maternity ward, right?
And why is that?
So, because of the demographic maybe that was going in there, right? But then what they did is they started doing early testing on the women that did come in, and early intervention like vitamin D. And then they had the better outcomes.
Wow.
Simple things like that.
So just to summarize, women of colour are obviously going to be absorbing vitamin D less in this country, particularly in the UK, because we don't have as much sunshine. So supplementation, really important.
Yeah.
What else? What's another thing that affects
fibroids?
Yeah.
We're more likely to be using certain chemicals on our hair, younger relaxers.
I'm convinced that I would have, I now, when I think back, I'm convinced that if I hadn't have been using like relaxers for like the best part of like 15, 20 years, that I would probably still have more eggs left even now. Like I'm convinced
it was a contributing factor to my lupus.
Wow. So you were chemically straightening your hair?
Because I grew up in a white community. My mum's white.
Yeah, but even people who wanted to look like Aaliyah.
Yeah, well, Aaliyah, yeah.
Still chemically straightening your hair. It's not even just
that.
Yeah.
So I chemically straightened my hair. Also, when I was modelling, they lightened my skin in Asia. So whenever I got too tanned, I got sent away and they would lighten the whole of my skin. And there's still lightening. You can go to Brixton or Streatham and you can get lightening skin products.
Oh my God.
And they're
Makes me wanna cry.
endocrine disruptors.
Right, so there's the skin
Heavy
lightening, there's the
metals within
relaxer.
it.
Yeah, okay. Yeah. I mean, we know that women of colour we're more exposed to harmful toxins all over the place. Environmental, the beauty industry.
Yeah, but we need to stop buying that stuff.
Yeah, the things that we can control, we've got to stop.
Yeah. We have a choice. There's other products out there. We have a choice, and we have a choice not to put it on our children as well.
Absolutely.
Because they've got thinner skin, and then we're not protecting their fertility.
When I went to Essence Magazine Festival recently, which is, a huge, gorgeous festival for Black women in America, I was really thrilled to see so many more women with natural hair. Not that I'm kind of being some sort of natural hair warrior, because none of my business what anyone's doing. And I love weaves and wigs and extensions like the next person.
Yeah, I wear a wig.
But I loved the fact that you can just see that so many more women are embracing their natural hair. And I think a lot of it is to do with us just getting to grips more with knowing that it's harmful.
But even the chemicals that may be in the natural curl enhancers
100%.
are just as bad as half the relaxers.
This is why
even if you're wearing your hair natural, you could be still putting as many toxins on it as well.
This is why I started Clean Curls, because when I went on, it sounds like a really cheesy plug for the brand, but it's actually true, because when I went on a natural hair sort of journey, when I became pregnant, and then I thought, I want my kids to see me proud of my curls, I started to scan products with the UCAT app. I bet you love the UCAT app, don't you? And I was scanning loads of products, whether it was mainly beauty products. You can do food as well. And I was like, oh yeah, this is clean. And then all the things that were like free from this, free from that were scoring really low. And I thought, this is a lie. Like, the people are saying their stuff's clean.
Don't be fooled by the green washing. Just because it says does not contain this on the front, what does it contain on the back? And also you can put two chemicals together that create that one chemical that they said isn't on the front. So legally, it's not in there.
Yeah.
But because of the chemistry, it's in there.
Yeah. That's the science background coming through for you now.
And I'm like, I called Nivea out on that the other day, because they say that they've got one of their clean suntan lotions. And I'm like, yeah, but you put these other two things together and it makes that.
Yeah.
So it's not so clean, is it?
And your average consumer's not going to know the difference.
No, and why should we stand in there and start scanning it? Why should we have to? But it's got to that point where we have to.
But it's so quick now, which is
you just got.
Even my kids are like, they'll come back with a treat with their dad, and they're like, "It's green on you, cut." Oh my God,
that's hilarious.
But I think but it's becoming more transparent now, and so the in summary, we need more vitamin D. Also, and obviously, personal care products and
sanitary, is a big thing. You don't want to be sticking bleach up your vagina.
Right.
No.
So for anybody just listening to that soundbite,
that'll go out as a clip.
What I mean by that is I started to get to understand more in the last few years about the idea of organic. Tampons, sanitary towels. Even some of the big brands now are doing that too.
Yeah, they are.
Listen,
so we have a choice now.
Not to overshare, but this is what this podcast is all about. I'm currently on my period. I haven't seen one in 4 months. I thought that it was gone now. I was like, oh, okay, whatever. And then got very surprised in the last couple of days. And so I had to run to the supermarket and grab at the last minute. And I couldn't see any of the organic ones. So I was there smelling this, because I was like, I hate perfumed sanitary towels.
You don't want it. Why do you want it perfumed?
I mean, I know why people want it perfumed, but it worries me, the perfume, because perfumes and fragrances in any personal care product is one of the most dangerous, because they've got the phthalates in.
And you've got to think of the thinness of the vaginal tissue as well. It's
and mine is very sensitive
thin.
now.
It's very thin.
Yeah.
And it's absorbing it straight in. So we don't want perfume up there.
No, we don't want perfume
or
up there.
Bleached products.
Yeah. And do you remember the whole, obviously the whole baby powder fiasco? And the women that died, and
and we were putting it on babies' vaginas.
And not just that though, in the Black community, that documentary that they did, it showed that a lot of women of colour, it was almost customary for us to put it in our beds, put it in our underwear. So there's a lot of that kind of perfumed personal care products and that whole kind of like idea of everything being like really clean, smelling amazing, that can actually be really dangerous. I would say another one is the stigma of like not talking about fertility issues in the Black
talk
community.
about fertility, talk about your periods, talk about menopause. So my 7-year-old said to me the other day, I'm testing out for a magazine different magnesiums, and one wasn't so great, and it had L-theanine and in it, and I don't react well to it, and it kept me awake, and I was moaning that I didn't have a good sleep. And she said, "Mummy," she only turned 7 last week. She said, "You know when you used to have periods, because I haven't had a period in nearly a year, you used to sleep really well." And she said, "Now you don't have periods. You have to take stuff to make yourself sleep well." And I used to think, because you're bleeding from your vagina, it wasn't a good thing. But now I'm going to be quite happy when I have my periods. I was like, go on, girl.
That is genius though, isn't it?
Yeah.
For her to have that understanding, that is so important. That's the same as my kids. They are well aware.
Because I've been, when I was bleeding, I'd be like, "Oh, can you go and get me a tampon?"
Yeah, you have to.
And she'd see me insert it. So she's not going to be freaking out and not knowing what to do with it when she starts her own period.
Before you go, and we could talk forever on this, we'll have to do some sort of seminar together or something. For people who are trying again after loss, and for people who are trying to conceive and not getting much joy, and then the joy from the intimacy is going, just like a quick word of advice on that, because there's a lot of pressure that comes with like you're weeing on a stick, I'm ovulating, all of this kind of stuff. Do you have any advice around that so that people can like keep the harmony in their relationship as well? And also you have to like try.
I think it's really important. So even in my book, I have like no sex days. And even with my couple, sometimes I've put them into separate rooms. I'm like, okay, for the next 2 weeks, you're in separate rooms. Because when you're in separate rooms, you want to have sex.
Clever.
Then, right? So then they have just sex for sex sake because they're in separate rooms, and they go back to that romancing of like text each other bed, or wish you were still in bed with me and things like that.
What if they stay in the separate rooms? They're like, actually, I'll get better sleep.
No, but then they have sex in the day. Sex doesn't have to be in the evening. It doesn't have to be in bed like when you're just like at your worst time. And we don't have to just stick to penetration. Like sex can be all those other things that you did before you had penetration when you first got together. Go back to those times. It's so important because it will make you feel better in yourself. It will make you feel connected. I also tell women, if your guy doesn't feel like it, go forth and masturbate. People think you can't masturbate in a relationship. You still can. You still got to look after yourself.
Yeah.
So that's my little 2 pence.
And I also think date nights are a good idea.
Date nights, I do a £10 date in the book because people think, oh, it's a date, we're really struggling, I have to take her out for a big dinner. £10. And then you have to use your imagination.
Oh, I like that. That's really nice. And but on a practical level, I'll say one more thing. Those ovulation sticks are brilliant though. They really are. Because I think then you can be quite sort of like effective with it, can't you?
Yeah.
Because not every would you say that?
I think not everybody knows when they're ovulating. You've got your cervical mucus as well. Not everybody knows there's certain apps and everything, wearables that people can use now. So
that's a good tool, isn't it?
Go for that data.
Yeah. Liberty, I could speak to you for hours, weeks, but it was so nice to talk to you.
Thank you.
Good luck to anybody who's trying to conceive.
Yeah, just good luck to everyone, and please just reach out. I answer every single person, and quite often I'll do it with a voice note, because if you are on this journey, please do not think you are alone. There are so many other people, whatever age you are.
And what's your socials? Where can people know you?
Oh, it's mills.liberty.
Love it. And the book as well. You can
always get the book.
Get the book.
Get the book.
360 Fertility.
Or even get it as a gift for someone that you know is struggling and you don't know what to say to them.
Yeah.
I think that's a really beautiful thing to do.
And I would also say as well, like if you're someone that does have children, it's nice to be sensitive, isn't it?
Yeah.
And kind of, not asking people, when are you going to have kids? And
100%.
That language that we use.
Or an older parent, you don't know what they're going through. Or if you do find out, don't keep asking them all the time.
Yeah.
And maybe get them a gift of something like that.
I think that's really, really important. Thank you so much.
Thank you.